Reconnect and heal today. Welcome to Love Never Dies with Dr. Jamie Turndorf.
Hello, everybody, and welcome to Love Never Dies Radio on Dream Vision 7 Radio Network, broadcasting in 136 countries, and Dr. Turndorf Turn on the Love on Binge Network's television, which is heard all over the world and viewed everywhere in the world on every smart TV. So everybody, I have a question for you. Did you know that the iris of your eye can reveal breast cancer and other illnesses? Bet you never thought about that. But it's a fact that through the use of cameras, flashlights, and microscopes, iridologists can examine a patient's iris in order to detect tissue change, stromal irregularities, and pigment patterns that can provide early detection of diseases. So today we're going to have an eye-opening interview, if you'll pardon my pitiful pun, with Dr. Jurasunas, one of the top natural medicine research pioneers in the world. Dr. Jurasunas was born in France and emigrated to the US in 1960. He's a doctor of naturopathic and homeopathic medicine who initially trained in South Africa, England, and North America, where he discovered the science of iridology. In fact, Dr. Jurasunas has done extensive research on the science and diagnosis of iridology with some of the best specialists in the world, like Dr. Bernard Jensen of Escondido, California, and Professor Jay Deck of Germany. Dr. Jurasunas has been in practice for 53 years, and he's an internationally known practitioner and researcher, not only in naturopathic medicine, but especially in naturopathic oncology and integrative oncology. His areas of focus include live blood analysis and oxidative dry blood testing, and the use of nutrition and detox in healing as the pillars of treatment. Since 1971, he has pioneered a field of theory and research linking mitochondria and cellular respiration as the cause of disease and cancer. He's the author of more than 150 papers, articles, and conferences available online and through SlideShare, and 8 books in 3 languages focusing on the health revolution, iridology, colon detox, and lapacho and germanium in the treatment of cancer. His most recent book, Health and Disease Begin in the Colon, is a really important book for doctors and laymen alike. And his new book, Cancer Treatment Breakthrough Immuno-Oncology Using Rice Bran Arabinoxylan Compound, is going to be published in the United States. He's also delivered lectures in over 45 countries and at various universities. During his lifetime, he's received many awards and gold collars from academies, including the Silver Medal of Research and Invention by the French Academy for his discoveries in the field of iridology. And more recently, he received the U.S. Lifetime Achievement Award for his 50 years of pioneering work in the field of education, natural health, and cancer. And today, Dr. Professor Serge Jurasunas maintains a part-time private practice for cancer patients, and he consults with patients from around the world via Skype. So without further ado, let me introduce you to Dr. Jurasunas. Hello, so happy to have you.
So many things about me,
I know. When you hear your bio, you think, is that me? Did I do all that?
54 years is a lot, and it might be exaggerating what I have done, but it took 54 years to have done what I have done. You understand? So
exactly. And you know what? Frankly, I had to shorten your bio, or else we wouldn't have had an interview.
Sometimes it takes you 10 to 20 years to search something and to come to the conclusion.
Absolutely. Absolutely. As a psychoanalyst, you only really start to get good in your 60s. I swear. It takes a really long time, as you know. So why don't you tell everyone, why and how did you become a naturopathic doctor and an iridologist? How did this happen? Why?
Yeah, okay. Well, I think sometimes, the life show you the path, the road where you have to go. You understand? Because I was born in a small fisherman town in France, and it was after the war. It was not very good, the life there. So I immigrate, and maybe I will explain more later on when we speak about cancer, because my father and my mother, they died of cancer, see? So I run away, and you know, it stays something in my mind that's something wrong with the medicine, you know, medical doctor. So when I arrive in Los Angeles, you know, I eat like everybody, you know, even I smoke it, you know, but I like natural food anyway. And I start to have some problem with my nerve and my vision because of a lot of stress, you know. I was only 18 years, you know, a lot of stress. You know? So I want to see a medical doctor, and he say, oh, you have to go, I see nothing wrong, you have to see a neurologist. So I went to neurologist, and you know, he put some electrode on my brain, and he said, you must see a psychiatric doctor. And I told him, I'm not crazy, so I don't. So
this is what they do when they can't find the answer. They say it's all in your head.
So I said, no, okay, I'm going to see for myself. You know? And then I was living in the court house, and I have a neighbor. There was a lady who lived in India, and she cured herself from colon cancer with the herbs and things like that in India. And sometimes she was talking to me. She was a very nice lady, you know, telling me about carrot juice and things like that, you know. But I was not listening. But when I get, so one day she said, why don't you see a doctor of natural living? And I said, natural living? I don't know what this means, but okay. So I went there, you know, because she was the secretary of Dr. Jensen twice a week in Los Angeles. So I went there, you know, he was a nice man, and he looked in my eyes and that, blah, blah, blah. He told me everything. And I said, this is what I need. This is what I'm going to do in my life, you know. You know, and I walk out of the office with his prescription, and I bought the book, his book of iridology and his book of cooking. You understand? And then I say to myself, that will be my life. You see, to be a naturopath and iridologist. And then, because Dr. Jensen, maybe he saw something with me, you know, so he invited me one day, he said, why don't you come with me to Hidden Valley El Trench, you know, when he was walking, you know, in the valley, you know, near Escondido. And I said, okay, I go. And then I see with my eyes, you know, before I knew or learned it, you know, I see the result. He said, you are going to see what natural medicine, natural food can do. So I was acquainted at that time with the colonic, with detoxification, with all the juice.
Colonic is, in English, it would be high colonics. That's what colonic is, high colonic.
At that time, detox and the food diet, and they have their own organic garden, you know, to have best food. So I saw for myself, you know, before I learned it, you know, how people recover it, not taking medication. And it was the beginning of my life. So I went to Canada, to French Canada, to start a course of naturopathy in French, and that's it. That's the way I become. But this is what you believe it. You understand? You do it. It's not like a profession or a job. You know, there's something inside of you.
It's a calling. We say in English, it's a calling.
Yeah, well,
it's
yes.
Your calling.
Yeah.
And so your parents were integral in your calling. Having them both leave their bodies from cancer gave you the calling to prevent and reverse cancer in others. So, yeah.
Yeah, well, okay. Maybe if you talk about cancer, you know, maybe I should tell you why I am so, no in the word enthusiasm, but so deep involved with cancer. And I told you a few minutes ago that my father died. I think it was pancreatic or liver cancer, I forget, but it was terrible. It was terrible, you know. And in the house was like a pharmacy with a smell, you know. I say, no more medicine for me, you understand? I want to know. And my mother also died of cancer. So when I enter, you know, become a naturopath, and one day I found a book by Dr. Max Gerson, you know, maybe you know.
That's the person who made famous the cancer treatment by juicing.
So when I found the book and I read the book and I say, that's it. you know, no, I don't want to see any more suffering with people, and I will do something if I can cure those people and you know, combat this disease. And this is why I am so much involved, because, you know, I'm thinking always about my father, how he suffered, and my mother.
Right.
That, you understand?
Right. So can I just ask you something, because this has been in my thoughts regarding juicing, because I know Max Gerson cures patients of cancer using gallons of juice a day. Now, this is what I wanted to ask you. We know that obviously there are tremendous anti-cancer properties of the juice itself, but we know that sugar, even natural sugar, can elevate our insulin. And for those who have high insulin, hyperinsulinemia, when they have high sugar, they are much more at risk of developing cancer. So does the high sugar content of the juice make people who have high insulin more prone to cancer rather than reversing it?
Well, okay, that's it's not so easy to answer, because you have to understand that when, at the time of Dr. McGerson, you know, when he started, you know, the human body was different than it is today. You understand? The human body was not so degenerating like today, and it was much more easy to treat. Even me, I remember
Right.
When I started in Portugal 50 years ago, it was much more easy to treat cancer, because we have, over the years, we have deteriorated our body with bad food and chemical, you know, and we have
a lot of people have high insulin
system that we're going to talk about. So, of course, they say today, of course, you have sugar in carrot juice, but I have seen cure of cancer with juices, with carrot juice and things like that.
Even for people who have high insulin, you're saying, even for those people who have high insulin, the juices can cure them of cancer.
No, I tell you this, you know, when I was in Dr. Jensen, you know, we have not much information, you understand? But I have treated cancer, let's say 30 years before, giving all kind of juice, and I have cow juice, big juice, and then I have result. You know, because theory, it's okay, but it's not always working, theory, you know.
But it works. It works for
I understand that the tumor need carbohydrate and sugar.
Right, they feed on it, right.
But you can target the tumor in some other way. You understand? If you destroy, you know, the blood vessels of the tumor and don't let the tumor make a new blood vessel, the tumor is inhibited. The tumor decrease.
Right, right.
Sugar or you give all rice. You understand?
Got it.
So you know, in theory, it's okay, theory, but you have to do in practice yourself. Then you find for yourself out, you know. I still use, you know, in fact, I'm writing a book now on diet and nutrition, and I give my, you know, my recipe of 50 years, you know, and I give the recipe of my combination of vegetable juice, you know, for cancer. And we have carrot juice, beet juice, and broccoli, you say sprout, broccoli juice.
Broccoli sprout juice?
Sprouts, broccoli, you know, and black radish, you know.
Oh, yeah.
And then you mix it up. You can use watercress sprout sometime. And then you will see this is really anti-cancer. This is working, you know. Fantastic. No matter what the theory is working, you know.
And you know, you told me in an email you've told me recently of cases of people who are really on death's door from the traditional Western chemo drug therapies, and that you've worked with a lot of people who were told just go home, it's the end, and you've turned it around for them. A young boy, an older man. You've told me about these cases.
Well, there is, you know, I have experimented all the things you can imagine in my lifetime, and thanks God, you know, I have seen some miracle, you know, like you told me one day, you know, and I don't know if we are called miracle, but it's not always, you know, but often you have a patient that comes that he has only a few months to live, you know, and then after 4 or 5 years, he's still here in good condition. You understand?
Right.
So, but it doesn't work with everybody because each patient is an individual. Genetic standpoint, health standpoint, you understand? How much chemotherapy has damaged the patient or not? You understand? But still, the patient can recover. The body is intelligent, a smart machine. You know, if you give everything it needs, it will recuperate. You understand?
It's true.
Because
So
when,
it's so
when
true.
you treat cancer, when you treat cancer, okay, you treat the tumor, the disease, but you treat the whole body in the same time. So you help the body to regenerate and the immune system, the nervous system, you understand? Even the brain, even the psychic, even spirituality is very important. You see? That the whole thing like that, it works better if it's true that when you treat children, they respond much better than adults. Children, you know?
And that's because
the photo I sent you.
The photo of the child, yes.
Yeah, the boy, the young boy. You see how you can change in 3 months someone.
It's much because there's less toxicity in the body, less entrenched patterns. You know, I know you like to quote Eli Mechnikov, who said death begins in the colon, that Russian scientist.
Okay.
You believe this, I know, and you've written about this.
But I think, you know, first, you know, why I have understood so much about the colon, you understand? It's because of iridology, you know. So we have been in advance, you know, when they say now you have a second brain, you know, in the guts, you know, we have seen that with iridology 40 years ago. Now, maybe I show, you know, for the people see that, you know, the organs are all, we can see, that's the
left eye
of iridology. And that was made by Dr. Jensen, you know, it took time, you know, a lot of time before he could develop this chart where you see each organ are located. And in the middle, you see is the colon, you see. So the organs are located, they appear in the chart equal as in the embryo. Equal as the embryo, you see. The first organ that develop in the embryo is the colon, the guts, the primitive guts, and this is the right and left. Okay, so the guts, primitive guts, and then each organ, the liver, the pancreas, you understand, ovary, they bud on the colon, on the tissue. It's the same tissue. It's the same tissue. The colon of the liver is the same tissue. The colon and the pancreas is the same tissue. Understand? So if you have for instance, hepatitis or cancer, you know, it's not only of the organ that we are talking about, the liver or the pancreas, we are talking about the colon. And you see in the iris, you know. So the colon is the king of the body, you know, and then we have the colon to expulse, and we have the intestine, where is the, we call the second brain and the microbiome, you understand? But
the microbiome.
Yeah. Today we intoxicate our body because the colon does not function, does not eliminate. You understand? This is the beginning of all the disease. We can talk about science, you know, but this is the way it's functioning in the body. You understand?
And we have, you know, I know you made a comment to me about in the US where our food is loaded with glyphosate residue, which causes leaky gut, intestinal permeability. So the toxins go back through the bowel. And we have so much of that here.
The toxin.
Oh, they get reabsorbed through the bowel because our bowel wall is damaged by the glyphosate.
No, you're talking maybe about the intestine, not talking about the colon, you know, where there is the waste to be eliminated, you know. Now, if you don't eliminate twice a day or at minimum, you know, it stays in the colon, it sticks in the colon, you understand?
And
then you develop putrefaction in the colon.
Hold the thought. We're going to take a break and we'll come back and we'll talk more about stagnating fecal matter in the colon. I'll be back with you in a moment. on Love Never Dies Radio, and Dr. Turndorf, turn on the love.
Hi, it's Dr. Jamie Turndorf here, and I have a question for you. Are you or someone you love a veteran suffering from undiagnosed PTSD? According to statistics, between 100 and 200,000 vets suffer PTSD. But did you know that there's an arbitrary diagnostic loophole that denies the PTSD diagnosis to vets who suffer a coexisting mental health disorder? Meanwhile, according to the British Psychiatric Journal, it is rare for vets to suffer PTSD without a coexisting mental health disorder. This means that millions of vets with PTSD don't even know they have it and aren't getting treatment for it. Read my new column, Winning the War on PTSD, in mastersofhealthmag.com and discover a cutting-edge, research-backed new solution to PTSD that you've never heard about. The exciting news is this solution is free for vets with PTSD. Go to mastersofhealthmag.com, take my free PTSD quiz right away, and start your healing journey today. Wishing you all the love in this world and beyond, I'm Dr. Jamie Turndorf.
Love Never Dies is now on the Dream Vision 7 radio network every Wednesday and Thursday at 1 p.m. and 1 a.m. Eastern Time. Dr. Jamie Turndorf, also known as Dr. Love, is the #1 international best-selling author of Love Never Dies, How to Reconnect and Make Peace with the Deceased. If you're grieving the loss of a loved one, tune in and find out how to reconnect and heal any unfinished business using Dr. Turndorf's groundbreaking new Dialoguing with the Departed technique. Visit AskDrLove.com to find out more.
This is Dream Vision 7 Radio Network, uniting mankind with universal love. Our shows are created from the heart, bringing each listener to a place of divine enlightenment. Breathe, relax, and enjoy. Let life flow.
You're listening to Love Never Dies with Dr. Jamie Turndorf. If you yearn to get along better with your life partner or spouse, friends, family members, and even coworkers, Dr. Turndorf's book, Kiss Your Fights Goodbye, Dr. Love's 10 Simple Steps to Cooling Conflict and Rekindling Your Relationship, shows you how to turn conflict into connection for a lifetime of lasting love. Find out more about Kiss Your Fights Goodbye at AskDrLove.com. This is Love Never Dies with Dr. Jamie Turndorf. This show is for you, the listener. Once again, here's Dr. Turndorf.
Let me explain you, of course, people have to understand that there is no two iris which are the same. You understand? It shows that you have the genetic is different for everybody. You understand? So here you have a very good iris with the constitution, and here you have a very, very bad iris with the cancer, Okay. Now, talking about the toxin, here you have something you can see. I think you can see here.
Oh,
right? Okay, this is the brain area. And what you see, the black coming out, that is a toxin coming from the colon and going to the brain, And this is a girl, girl. And when you see things like that, they are very nervous, aggressive. The colon is functioning every 4-5 days, things like that. But it appears like that in the iris. You see?
I've never done this before, and maybe you've certainly never done this before. If I put my eyeball up against the camera, can you see it?
No. You need a microscope.
Oh, you can't see it that way.
It's possible. You see?
Got it.
These are different. This is very bad colon. Very, very bad colon. In fact, this is a cancer. Cancer of the ascending colon. A very bad colon, I'm going to have an article in Master Health where I have this photo published in an article will explain iridology.
Oh, that's fascinating. Now tell me, how many naturopathic doctors also practice iridology in France or in Europe?
I don't know.
It's very small.
I don't know in your country, in Germany, there is maybe 25,000, maybe in Germany, but with Germany is the where it starts, practically iridology. But I wrote a big book, about
health and disease in the colon, and how you can diagnose through the iris of the eye.
It's all my work, 50 years of my life. You have a lot of
fantastic.
Here you have a very toxic colon. Here you have a very, very toxic colon here.
But that's that same image of the colon toxicity leading to the brain.
It's a case of epilepsy, which is...
Wait, come back to the other one. The one you just showed looked like the photo of the girl with the black strings coming from the colon to the brain. Did that person have brain cancer?
Yeah.
The one in the book looks like that girl with the colon.
Yeah, I think we have this photo in the book. You have the photo in the book.
No, what I'm saying is the photo you just showed in the book of the black strings going up into the brain area. Was that another example of the colon causing brain cancer in the book?
No, that showed it showed very toxic colon. It's very dark, you see. When the colon is intoxicated, it's very, very dark, you see. You see
right. Now go back to the book. I want to see the picture you just showed in the book, because I'm looking at the little girl's photo, the very toxic colon.
I don't know where
that's all right. It's because it looks very similar to me.
I don't find anymore. Yeah.
That's all right. Don't worry about it. So,
but
you look at the eye under a microscope, and then you're able to make the diagnosis of what's wrong.
Okay, you see, I told you, you have a yes, because there is no two eyes which are the same. You understand? This is typical, normal, 100% healthy person, normal constitution, you see. But today, it's very difficult to find this constitution because everybody is sick. Today, you don't find anymore. You know, so now, the question, I am involved with science and, the technology today. So, why I use iridology? Then I use iridology because you see the whole patient, and then you see maybe the cause of the disease, You don't have the name of the disease writing in the iris, but you understand what's going on with your patient. See, we do iridology, and it's why, as let me see, as I was working with cancer, and keep using iridology,
So let me ask you this.
It took me 20 years to develop a chart. What you can see the breast cancer risk, the mark, the landscape, You have many signals, that show you that this person have a high risk of breast cancer.
And so what do you see in the iris that shows you the high breast cancer?
I will publish this, in Master Health, we'll publish this, etc. But now, of course, we can maybe talk a little bit about cancer or about my second book, and then we talk about the immune system, maybe.
Whatever you want to discuss, we're here to learn from you. Cancer Treatment Breakthrough, this book.
Yeah, this is the book I have written. It talk about speaking about the immuno-oncology, which is not new for me because I am using the immune system since 35 years, but now they say, oh, that's it. That's the body itself that can cure cancer. Understand? The immune system. All right. So we have some special cells in the body, that we call NCAP cells. And this is a tumor And this is the immune cells that is attacking the tumor.
Now, which cells are attacking? Are they the natural killer cells?
I will explain. Just, okay, here you have cancer cells, and here you have natural killer cells. It's called NCAP cells. So this is also the reason of the book. The natural killer cells, we said this is the first defense against cancer. And in fact, and it's true, I have several oncologists that agree with me. Why do we have a cancer? Should be a rare disease if we have a good immune system. So what's going on? Now, NCAP cells are type of cells that circulating constantly in the blood, they patrol, and anything wrong, they attach to the abnormal cell or cancer cells, and then they produce a toxic enzyme that kill the cancer cells, in 5 minutes. But the only problem, when you have a cancer, we have found out that the human system, the NK cells, are functioning only 10%, 40% of their full activity. You understand? And we have seen the example now with the coronavirus, the aged people who died because they don't have a good immune system, because with the age, NCAP cell activity is going down. You understand? So we have to stimulate. And this is one of my way to treat cancer, the immune system and the apoptosis. And this is the reason of this book. We use a rice bran arabinoxylan compound, which means brown rice, which has been modified with enzyme of mushroom, shiitake. So the big molecule are coated, and then the compound is immediately absorbed in the body, and then it's going to fight the cancer cells.
So you're saying that compound increases the natural killer cell activity?
Yeah, exactly. It really increases the activity, after, if you give, to a volunteer, after 2-3 days, you see it's increasing, and sometimes it go to 600% increase in activity. Like for instance, in the prostatic cancer or breast cancer, it's increasing. So there is a lot of paper about this compound. I have made a lecture everywhere in the world. And in fact, this is one, the foreword is by Dr. Conley. Dr. Conley.
Yes, she was on the show.
He's talking about cancer, he's talking about even iridology, he's talking about the microbiome, he's talking about the P53, the gene that I spent 15 years of my life, to do the test with the P53, with the cancer patient, But even using this, iridology is still important,
May I ask you a question?
The immune system is becoming now the immunotherapy, the fourth pillar of oncology. Fourth pillar, which means you have the chemotherapy, surgery, radiotherapy, and then you have the immune response, immune therapy.
The immunotherapy.
So the immune system is important,
So may I ask you a question?
Yes.
So I'm wondering, because you have said that this special form of rice can activate by 600% the natural killer cell activity, can people use it as a prevention on a daily basis, or is it only recommended to be used when you have cancer? No.
First, it's a natural compound. It has no toxicity, and patient can take, I answer 1 minute, can take during 4 or 5 years, even more, no problem. Okay, now, at the moment.
But can you use it as a prevention?
But let me answer you, I will answer you, at the moment, the Japanese laboratory who manufacture this compound, is out of stock because everybody is buying this as a prevention against the coronavirus. Because the NCAP cells also kill the virus. Okay. Now, aged person, aged people can take this compound because their immune system is going down, and it's a good way to prevent cancer or have always the immune system activates.
And we don't adapt to it. Like with some remedies, if you take herbal remedies over time, they become less effective. That's not the case here.
I just tell you now, 1 minute, I tell you that patient can take, and I have my own experience also, but this other places, can take up to 6-7 years with the same effect. No toxicity and always active, always.
That's beautiful.
Advantage of this, and I want to correct you because I want to say that this compound can activate up to 60%, up to 60%, but it depends on the cancer. Some cancer can be 300%, 400%, but some 600%.
Up to.
Okay, so if you...
hold the thought because we have to take a break, okay? We'll be right back. Okay. Hold the thought. We'll be back in a moment on Love Never Dies Radio and Dr. Turndorf, Turn on the Love.
It's Dr. Jamie Turndorf here, and I have a question for you. Are you or someone you love a veteran suffering from undiagnosed PTSD? According to statistics, between 100 and 200,000 vets suffer PTSD. But did you know that there's an arbitrary diagnostic loophole that denies the PTSD diagnosis to vets who suffer a coexisting mental health disorder? Meanwhile, according to the British Psychiatric Journal, it is rare for vets to suffer PTSD without a coexisting mental health disorder. This means that millions of vets with PTSD don't even know they have it and aren't getting treatment for it. Read my new column, Winning the War on PTSD, in mastersofhealthmag.com and discover a cutting-edge, research-backed new solution to PTSD that you've never heard about. The exciting news is this solution is free for vets with PTSD. Go to mastersofhealthmag.com, take my free PTSD quiz right away, and start your healing journey today. Wishing you all the love in this world and beyond, I'm Dr. Jamie Turndorf.
Love Never Dies is now on the Dream Vision 7 radio network every Wednesday and Thursday at 1 p.m. and 1 a.m. Eastern Time. Dr. Jamie Turndorf, also known as Dr. Love, is the #1 international best-selling author of Love Never Dies, How to Reconnect and Make Peace with the Deceased. If you're grieving the loss of a loved one, tune in and find out how to reconnect and heal any unfinished business using Dr. Turndorf's groundbreaking new Dialoguing with the Departed technique. Visit AskDrLove.com to find out more.
This is Dream Vision 7 Radio Network, uniting mankind with universal love. Our shows are created from the heart, bringing each listener to a place of divine enlightenment. Breathe, relax, and enjoy. Let life flow.
You're listening to Love Never Dies with Dr. Jamie Turndorf. If you can't stop crying over the bodily loss of a loved one, Dr. Turndorf's #1 international bestseller, Love Never Dies, How to Reconnect and Make Peace with the Deceased, will show you how to toss out the tissues and transform your grief into joy using her groundbreaking new Dialoguing with the Departed technique that enables you to reconnect and even heal unfinished business with those in spirit without the assistance of a medium, channeler, or psychic. Sign up for Dr. Love's free newsletter at AskDrLove.com and receive an exciting gift, a free excerpt of Love Never Dies. And now, back to Love Never Dies with Dr. Jamie Turndorf.
Hello again, and welcome back to Love Never Dies Radio on Dream Vision 7 Radio Network and Dr. Turndorf, Turn on the Love on Binge Networks TV. We're talking with Dr. Jurasunas, the internationally known practitioner and researcher, who specializes in iridology, naturopathic medicine, especially naturopathic oncology and integrative oncology. Before we went to the break, you were talking about how the immune system is essential in the, okay, and you have a book that you wanted to share.
Let me tell you first why I wrote this book, you know. When I use something for my patient, I have to be convinced that I will have results. You understand? I have to make a proof, I have to experiment, and maybe if there is scientific proof, it's okay. Now, I am using for this compound for the past 25 years. You see, and I have made, for the Japanese, I have made several lecture, you know, seminar. But because I have some excellent results, you know, that I will not get with other compound that I still use, and I wrote the book. Now, if you don't mind, I show you, if you don't mind, this is a very large, you see, enormous tumor of the stomach. Very enormous, 18 centimeters. It's very big, you know, the women, you know. Now, I will give 3 products, and then after 3 months, here is small tumor after 3 months. You see the one, enormous, and you see the small one.
Fantastic.
90% was eliminated in 3 months, you see. And what? There is 3 important ways, you know, that you deal with the cancer target. The blood vessels, the apoptosis, the p53, and the immune system. And then you need very good products, you know. So I use the 3 like that, and you see the result, you have it. And that's it.
And do you
and this is why, you know, that is so important, but you have to have something of high quality, you know, to use it, you know, because unfortunately you find the world is a lot of junk on the market and online, you know, and then you will not get the result that you are expecting, you know. Now, again, you know, you asked me the question as a prevention, because, you know, for medical doctor is a headache, because something that is for cancer cannot be for prevention. You cannot do chemotherapy for prevention of cancer, you understand? So they say, oh, if it's good for prevention, it cannot be good for cancer. Yeah, it's good for cancer because this is your immune system who destroy the cancer cells, you know, it's not the chemotherapy. And in fact, if you use chemotherapy in the same time, you know, this compound, you have much better result. Much better result. You have much more cancer cells are destroyed faster and with less toxic effect for the patient. You understand? Because after all, how it works, chemotherapy, it's only to destroy cancer cells via apoptosis. You know that yourself, apoptosis. So now, if the apoptosis is not functioning, if you have a mutation of the p53, the chemotherapy is very bad for the patient. And I have this case, you know, the patient I told you about in Vienna, you know, that he was almost dead from chemotherapy, and he decided to go back home. But after 2-3 days, arrive at home of the man, ambulance, doctor, and the police, and they force him to go back to hospital to have chemotherapy. But now I tell you the last news. This chemotherapy was so bad that the medical doctor, they get scared, so they send him back home. They send him home. Wait, but okay, now the reason they give it, they say, if we give you the chemotherapy, you live 1 year. If you don't do chemotherapy, you live 2 months. But first is the patient who decide how long he has to live, not the doctor. But now it's not 1 year or 2 months, it's 2 weeks. Because the patient is dying at the moment. It's the last day of the patient. And the chemotherapy kill him. And you know why? Because also the people, often they believe only in chemotherapy. But if they will do something in the same time, using the immune system, improving all the function in the body, they will have much less problem and more result with chemotherapy. You see?
Right. Now, you talked about the gene suppression, the p53 gene suppression. In your practice, do you work on helping the gene to function better?
Yeah, well, maybe, you know, some people, you know, sometimes, you know, when I start 15 years ago here in Portugal, you know, talking about the P53 to the patient, it's like I was talking about the alien, you know, nobody understood, you know, this is the small gene, the P53, you know, but our body, our cells have a system of suicide, you know, the auto-destruction. You know, if anybody is wrong, you know, cells is damaged by stress, for instance, is destroyed. You know, you have every day, can you believe that 60 billion of cells are destroyed every day in your body and you don't know? 60 billion, but they are replaced immediately. You understand? So when you have when the cell is damaged by pollution, stress, things like that, the P53 is activating, it kills, it destroys it, you know, it's eliminated naturally, okay? So when you have a cancer cell, that's a cancer cell that doesn't want to die. And why it doesn't want to die? Because the gene of apoptosis is not activated, it's mutated. So you do chemotherapy, but you harm the patient, but you don't kill the cancer cell. You know, on the contrary, you have more cancer cells, more metastasis if you do too much chemotherapy because the P53 and other genes of apoptosis are not functioning. And the gene of resistance, like the BCL2, are very activated. You understand?
So again, is there a way that you work on reversing the P53 gene mutation or suppression? Do you have protocols for that?
Yes. Well, okay. You have to understand, you know, again, you know, I have always done everything by myself, you know. So when I start, you know, with the P53, I was ignorant, you know. I start to learn things like that because, you know, all the books were talking about the P53. And one day I said to myself, okay, I have to know if my patient have a P53 inactivate, activate, or there is a mutation. And that's why. Now, what I'm going to do if there is a mutation of P53, I don't know. So I start to experiment, you know, and then I have a result. And it was published in Thomson Leather magazine, my first report on the patient with the cancer, because today, reactivating the P53 with the science is considered a treatment of cancer. It's considered treatment of cancer. You know?
So how do you do that? How do you reactivate the P53?
A secret like that.
Oh,
you know.
it's a secret. Okay.
You have many food. For instance, of course, if you use broccoli, sulforaphane, you know, natural food, it activate the P53. But the mutation, you know, I have used peptide, you see in English, peptide of fish, you know, the short chain of amino acid. Short chain of amino acid from fish.
The short chain amino acid from fish?
From fish, you know. It's called oligonucleotide, you know. Guna have one product, I think it's called zebra fish, made from a zebra fish. Guna is very good. Now you use the live yeast cells that I have used, it's called Zeloxygen, you find in the state. This also reactivate mutation of the P53.
Fantastic.
But, there is many things, you know, I didn't have in my mind everything, you know. But you have many compounds that reactivate, you know, like the curcuma. The curcuma, resveratrol, will reactivate the P53. You understand? I have several hundreds of tests I have done the past 15 years, and it's wonderful how you see how you can not only improve the gene activity, but you are going to see that the tumor is decreasing in the same time, you know. It's what I'm going to say. I have said in my article, I start, you know, I say, we're supposed to be healthy, but do I am healthy? I don't know. Do I have a risk of a cancer? I don't know. You understand? So have a better food, better diet, sometimes take some supplements, some vitamins, you know, detoxify your body, you know, and be a good person. Be positive also. And this is the message I have for you.
And I agree with you. And also,
and read the book Love Never Died. This is also true.
Oh, Love Never Dies. And it's so funny. You were in sync with me, because I was going to say that I read yesterday that the love hormone, oxytocin, makes the body more alkaline. And we know that an alkaline body is a healthy body, a body that's not so prone to cancer. So truly, love is the cure after all.
Yeah.
Love. Connecting on the earth plane, connecting to our loved ones in spirit. The more love we have, the better it helps our whole body, right?
And then you have more vibration. So we are protected from disease, because our body is vibration, like in the cosmos.
Absolutely right.
Then we have to activate those vibrations, and the pollution is going down, the vibration.
Oh, your vibration. Well, you know what? You have raised my vibration today. It has been my joy to have you on the show. My door, my camera is always open to you. When you have your new book, you'll come back. So I'm not going to say goodbye. I'm just going to say a bientôt. I'll see you next time.
When the book will be published, I will come back.
You'll come back. See you next time on Love Never Dies Radio.
Not everyone. Okay? All right.
Bye-bye.
This is Dream Vision 7 Radio Network, uniting mankind with universal love. Our shows are created from the heart, bringing each listener to a place of divine enlightenment. Breathe, relax, and enjoy. Let life flow.